Caring for a newborn in the first month of life is a unique journey, full of wonder, challenges, and endless learning. For many parents, especially first-time moms and dads, this stage brings immense happiness along with countless questions and concerns. How do you ensure your baby gets enough nutrition? How do you help your baby sleep well? Why does your baby cry so often? How much weight gain is considered normal? This comprehensive guide will address all of these questions and provide detailed instructions on nutrition, sleep, hygiene, motor development, emotional bonding, and warning signs to watch for. The information is based on both medical expertise and practical parenting experience, so you can feel more confident in caring for your little one. Development of a 1-month-old baby. During the first month, your newborn begins adapting to life outside the womb after 9 months of protection inside the mother's body. This is a critical period when the baby's immune system is still immature and the nervous system is rapidly developing. 1. Weight and length. Full-term newborns typically weigh 6.6 to 7.7 kilograms, 3.0 to 3.5 kg, and measure about 20 inches, 50 centimeters in length at birth. During the first week, babies may lose 5 to 10% of their birth weight. This is called physiological weight loss and occurs due to fluid loss through skin and breathing, passing meconium, and initial low milk intake. After 7 to 10 days, weight gain resumes. By the end of the first month, babies typically gain 2 to 2.5 kilograms, 1 to 1.2 kg. Some may gain even more if feeding well. 2. Head circumference. Average at birth. 13.4, 113.8 inches, 34 to 35 centimeters. Increases by about 0.8 inches, 2 centimeters, during the first month. Parents should record weight, length, and head circumference monthly. If your baby is gaining weight too slowly or not at all, consult your pediatrician to check feeding habits and overall health. 2. Nutrition for newborns. Breast milk is the best source of nutrition for newborns. The World Health Organization, WHO, recommends exclusive breastfeeding for the first 6 months because it provides complete, balanced nutrition, immune-boosting antibodies, especially IgA, reduced risks of allergies, obesity, and type 2 diabetes later in life, emotional bonding between mother and baby through skin-to-skin contact. 1. How to breastfeed correctly. Start breastfeeding within the first hour after birth to benefit from colostrum, the first milk rich in antibodies. Feed on demand, about 10 to 12 times per day, every 2 to 3 hours. Let the baby finish one breast before switching to the other so they get both foremilk, more water, and hind milk, richer in fat and calories. Correct latch, baby's head, shoulders, and body in a straight line. Face toward the breast, mouth covering the areola, not just the nipple. 2. If mother has low milk supply or cannot breastfeed, use infant formula suitable for age and health condition. Prepare formula according to instructions, ensure bottle hygiene, wash hands before feeding, and sterilize nipples and bottles regularly. 3. Tips to increase milk supply. Breastfeed frequently, including at night. Prolactin levels peak at night. Stay hydrated and eat nutritious foods. Warm soups, green vegetables, whole grains, fruits. Keep stress levels low and ensure adequate rest. 3. Digestive care. A newborn's digestive system is immature and may experience common issues like spitting up, gas, or constipation. 1. Spitting up happens because the baby's stomach is small and the lower esophageal sphincter is not fully developed. To reduce spitting up, feed in small amounts, avoid overfeeding. Hold baby upright for 10 to 15 minutes after feeding. Gently burp. Keep baby's head elevated 15 to 30 degrees for 20 to 30 minutes after feeding. 2. Bowel movements, breastfed babies. Yellow, soft stools, 3 to 5 times a day. Formula-fed babies. Thicker stools, fewer bowel movements, more prone to constipation. If no bowel movement for 2-3 days and stools are hard, adjust the mother's diet or consider changing formula. IV. Skin and umbilical cord care. 1. Newborn jaundice. Physiological jaundice appears on days 2-3 and disappears by day 7-10 in full-term babies, or up to 14 days in preterm infants. Warning signs of pathological jaundice. Yellowing spreads to palms, soles, eyes. Baby feeds poorly, appears lethargic. See a doctor immediately. 2. Umbilical cord care. The cord stump falls off after 7-10 days. Clean daily with 70% alcohol or saline solution. Keep the area dry and exposed to air. Never apply herbal powders, ointments, or unprescribed medications. Risk of infection. Signs of infection. Pus, foul odor, swelling, redness. Seek medical care immediately. 3. Bathing. Bathe baby daily for 5 to 10 minutes using warm water, 98 degrees to 100 degrees, 37 to 38 degrees, in a draft-free room. Use gentle, baby-safe cleansers. Dry and wrap baby warmly right after. V. Sleep patterns. Newborns sleep 16 to 18 hours day. Daytime, 5 to 6 hours. Night, 10 to 12 hours. Teach day-night distinction. Daytime, bright room, play with baby when awake. Nighttime, dim lights, quiet environment, minimal interaction. Always place baby on their back to sleep, on a firm mattress, no pillows, no stuffed toys. To reduce SIDS, sudden infant death syndrome, risk. 6. Communication and motor development. 1. Communication. Babies cry to signal hunger, wet diapers, temperature discomfort, or need for cuddling. Respond promptly. Prolonged crying can stress both baby and parents. 2. Primitive reflexes, rooting and sucking reflex, helps with breastfeeding. Moro reflex, startling response to loud noise. Palmar grasp reflex, baby grips your finger when placed in their palm. 3. Motor stimulation, supervised tummy time strengthens neck, shoulder, and back muscles. Talking, singing, and maintaining eye contact helps auditory and visual development. 7. Warning signs. Seek medical help immediately. Fever. Oxys 100.4 degrees. 38 degrees. Poor feeding or refusal to eat. Difficulty breathing, wheezing, bluish lips/skin. Severe or spreading jaundice. Seizures. Extreme sleepiness. Unresponsive behavior. Pale or white stools. Blood in stools. 8. Practical parenting tips. Monitor growth, weight, length, head circumference monthly. Follow immunization schedule strictly. Maintain a clean, smoke-free environment. Wash hands before handling the baby. Avoid kissing baby's face or mouth to prevent infections. Spend time cuddling, singing, and talking to foster emotional bonding. Use barrier creams with zinc oxide if redness appears. 3. Bath frequency. Daily baths are fine, but plain water is often enough. Soaps can dry newborn skin. IV. Common newborn issues and solutions. 1. Hiccups. Harmless, usually stop on their own. Feeding upright can reduce them. 2. Sneezing, normal reflex to clear nasal passages, not necessarily a cold. 3. Gas and colic. Try gentle tummy massages. Bicycle legs can relieve trapped gas. Some babies benefit from probiotics. Ask your pediatrician. 4. Spit up versus vomiting. Small amounts after feeding equals normal spit up. Forceful, repeated vomiting equals call doctor. V. Health and safety checklist. 1. Car seat safety. Always rear-facing in the back seat. Never hold baby in arms in a moving car. 2. Temperature control. Dress baby in one more layer than you're wearing. Overheating increases SIDS risk. 3. No smoking. Smoke exposure raises SIDS risk and causes respiratory problems. 4. Hand hygiene. Anyone holding baby should wash hands thoroughly. 5. Visitors. Limit visitors, especially during cold flu season. Ask sick friends or relatives to wait. 6. Support for mothers. 1. Physical recovery. Rest when baby sleeps. Eat balanced meals. Hydrate well. Postpartum bleeding can last 4-6 weeks. Heavy bleeding or large clots. See doctor. 2. Emotional health. Baby blues equals mood swings, tears, anxiety. In first 2 weeks equals common. Postpartum depression equals lasting sadness, hopelessness. Trouble bonding equals seek help early. 3. Breast care. Soreness in first days is common. Cracked nipples. Ensure correct latch. Apply breast milk or lanolin. 4. Pelvic floor and exercise. Gentle Kegel exercises help recovery. Wait for doctor's clearance before intense exercise. 7. Bonding and early learning. Chapter 1. Skin-to-skin contact. Calms baby, stabilizes temperature and heart rate, promotes breastfeeding success. 2. Talking and singing. Babies recognize familiar voices. Talk during diaper changes. Sing lullabies. 3. Eye contact. Hold baby 8 to 12 inches from your face. This is the best range for newborn vision. Reading aloud. Even newborns benefit from hearing language rhythms. Helps brain development. V8. Organization and parenting hacks. 1. Create a baby care station. Keep diapers, wipes, extra clothes in multiple spots around the house. 2. Track feedings and diapers. Apps or simple notebooks help notice patterns and spot problems early. 3. Prepare nighttime essentials. Set up a dim nightlight, diaper caddy, and water for mom to make night feeds easier. 4. Batch cook and freeze meals. Reduces stress when everyone is too tired to cook. Eye aches. When to call the doctor. I. Fever, 100/4D GF, 38D Gershis. Rectally. Fewer than 4 wet diapers in only 4 hours after day 4. Refusing to feed or persistent vomiting. Difficulty breathing, persistent cough. Unusual lethargy or irritability. Rash spreading quickly or with fever X. Final words of wisdom. Accept help from family friends. Meals, laundry, errands. Lower expectations about housework. Focus on baby and rest. Every baby is different. Avoid comparing with others. Trust your instincts. You know your baby best. Celebrate small wins. First smile, longer sleep stretch, regained birth weight. Parenting a newborn is exhausting, yet incredibly rewarding, with knowledge, support, and realistic expectations. You can navigate this precious first month more confidently and joyfully. Parenting a newborn can feel like stepping into a brand new world filled with love, wonder, and sometimes anxiety. To help parents handle this stage with confidence, this final extended section offers in-depth explanations, real-life examples, and practical tools for both baby care and parental well-being. Advanced feeding guidelines. 1. Understanding hunger. Cues in detail. Before crying starts, babies show subtle signs: rooting, sucking hands, turning head toward a touch on the cheek. Recognizing these cues early prevents frantic crying, making feeding calmer and easier. 2. Cluster feeding explained. Babies often feed every hour for several hours in the evening. This behavior boosts milk supply and satisfies growth needs. Many parents mistake this for insufficient milk. Rest assured, it's normal. 3. Growth spurts and sleep regression. Around week 3 or 4, growth spurts may disrupt both feeding and sleep routines. Offer extra feeds, comfort, and patience. Routines stabilize afterward. 4. Detailed burping techniques. Try multiple positions. Over the shoulder, classic position for most babies. Sitting on lap, baby leans forward slightly, supported under chin. Face down across lap, gentle but effective for stubborn gas bubbles. 5. Preventing gas and colic. Ensure correct latch to avoid swallowing air. Burp halfway through feeds as well as after. Keep a feeding diary to spot patterns causing discomfort. 2. Mastering newborn sleep. Chapter 1. Understanding sleep cycles. Newborns have 50 to 60-minute sleep cycles, transitioning between active, light, and quiet, deep sleep. They may stir, whimper, or move during light sleep. Avoid rushing to pick them up unless fully awake. 2. Bedtime routines. Even at this age, small routines help. Dim lights, soft music, gentle rocking signal bedtime approaching. 3. Daytime versus nighttime interaction. Day, talk, play, sunlight exposure helps set circadian rhythm. Night. Keep lights low, voices quiet, diaper changes calm and brief. 4. Safe co-sleeping facts. The American Academy of Pediatrics advises room sharing without bed sharing to reduce SIDS risk. If parents choose bed sharing, follow strict safety guidelines. Firm mattress, no pillows near baby, never on couches or armchairs. 3. Diapering, bathing, and skin protection. 1. Tracking diaper output. Wet and dirty diaper counts indicate hydration and feeding adequacy. Day 1, at least 1 wet diaper. Day 4 onwards, 6 to 8 wet diapers one day, several yellow stools for breastfed babies. 2. Preventing diaper rash. Change promptly after bowel movements. Expose bottom to air several minutes daily. Barrier creams with zinc oxide form protective layers. 3. Bathing best practices. Frequency, 2 to 3 times week with mild cleanser. Daily plain water baths are fine. Temperature, always test with elbow or bath thermometer. Ideal 98 to 100 degrees. Duration, under 10 minutes to avoid chilling. IV, handling common issues calmly. Chapter 1. Reflux versus vomiting. Spitting up small amounts post-feed is harmless. Persistent projectile vomiting or weight loss warrants medical evaluation for conditions like pyloric stenosis. 2. Hiccups and sneezing. Both are normal reflexes, not illness signs. Feeding upright reduces hiccups. Sneezing clears nasal passages naturally. 3. Blocked tear ducts. Mild eye discharge may occur from immature tear ducts. Clean gently with warm, damp cotton ball from inner to outer eye. Consult doctor if redness or swelling appears. 4. Colic management. Colic icky crying, 3 hours day, 3 days week, 3 weeks. Techniques: white noise machines, motion, stroller rides, car seat drives, swaddling and gentle rocking. V. Health and safety enhancements. G1. Car seat mastery. Install rear-facing seat at correct recline angle. Strap snug at armpit level. Avoid aftermarket inserts not crash tested. 2. Mind temperature awareness. Overheating is linked to CDS. Ideal room temperature 68 to 72 degrees Celsius. Baby's neck should feel warm, not sweaty. 3. Illness prevention. Limit visitors during flu season. Anyone handling baby must wash hands, masks if coughing or sick. 4. Emergency readiness. Keep pediatrician's number, nearest ER location, and baby's medical documents easily accessible. CSI. Supporting mothers holistically. 1. Physical healing. Vaginal births, perineal care with warm water rinses, pain relief sprays. C-sections, incision care, gentle mobilization after 24 hours unless advised otherwise. 2. Mental health vigilance. Baby blues resolve within 2 weeks. Postpartum depression signs: persistent sadness, bonding difficulties, appetite sleep changes. Seek professional help early. 3. Breastfeeding comfort. Engorgement relief: warm compress before feeds, cold compress after. Blocked ducts, massage toward nipple, frequent feeding. 4. Sleep for mothers. Nap when baby naps. Share night duties if possible. Use safe bassinets next to bed for convenience. 7. Bonding and early development activities. 1. Sensory stimulation. Talk softly, vary tone and pitch. Use high-contrast black and white toys. Newborns see contrasts best initially. 2. Tummy time. Start with 1 to 2 minutes a few times day, increasing gradually to strengthen neck and shoulder muscles. 3. Reading and music. Gentle lullabies, nursery rhymes, and picture books nurture language skills and emotional security. 4. Responsive parenting. Responding promptly to cries builds trust, forming secure attachment foundations. V8. Organization and family balance. 1. Meal prep and household management. Freezer meals, grocery delivery services, and simplified chores free parents time for baby care. 2. Tracking tools. Apps for feeding, diapers, milestones help doctors and parents monitor growth effectively. 3. Sharing responsibilities. Encourage partners to handle baths, burping, and diaper duty for bonding and parental rest balance. 4. Visitor boundaries. Set visiting hours. Limit overstimulation for both baby and recovering mother. Eye ticks. Warning signs requiring urgent care. Neat and tea. Fever 100 BIs. DGF or 38 degrees. Rectally. Labored breathing, persistent cough, wheezing, bluish lips, or skin discoloration. Dehydration. No urine for 8+ hours. Sunken soft spot. Seizures. Excessive lethargy. Inconsolable crying. Rash with fever or rapid spread X. Closing thoughts for new parents. Parenthood in the first month is both exhausting and transformative. Every diaper change, midnight feed, and lullaby strengthens the bond with your baby. Perfection isn't the goal. Responsiveness, love, and willingness to learn are what matter most. Ask for help when needed. Parenting takes a village. Celebrate small victories. First real smile, longer sleep stretches, regained birth weight. Remember, this stage passes quickly. Take photos, record memories, savor the cuddles. With the right knowledge, support, and realistic expectations, you can navigate the first month confidently, laying a strong foundation for your baby's health, happiness, and future development.